So, you've decided to go to grad school for public health. What should you consider? Hi, I'm Nadia. I recently got my Master of Public Health from George Washington University. I also recently shared my experience applying to graduate programs as well as deciding whether or not you should go to grad school. And this is the third video in that series, helping people decide where to take their education. These will be high-level considerations on what to look for in a program, but if you have specific questions, you can ask in the comments and I can try to help you out. So without further ado, let's get started. Kind of a basic level consideration before we go any further is what level of degree are you getting? Are you getting a master's or are you getting a doctorate? I wish I could give like a clear-cut answer on which one makes the most sense, but everyone is different, everyone's background is different. I can't prescribe that in a YouTube video. The next consideration is what kind of skills are you looking for in your program? Are you looking for research training, practical training, so what it looks like to work in public health in practice, or are you looking for leadership training? At the master's level, the typical division is between Master of Public Health, which is typically more practical, more aligned with those competencies provided by the Council on Education for Public Health, versus Master of Science, which tends to be more research focused. So that's like developing like statistical analysis skills, maybe working in a lab if you're in like a more biology-based program, things like that. At the doctoral level, the division tends to be between DRPH, which is more leadership focused and tends to be designed for people who have been working in public health for years, versus PhD, which kind of like the MS tends to be more research focused. Even though I mentioned those divisions, there can be overlap in any of these programs. For example, in GW's MPH program, there are available classes in qualitative and quantitative research methods. There's also classes on statistical software, and in our classes, we went over how to do literature reviews and ultimately be good stewards of both reading and conducting research. And that was something I really liked about the program. We were also required to do a practicum that met certain criteria that wasn't just doing research for a professor, so we also got that practical training as well. Additionally, for our culminating experiences, which were these final projects we had to do to complete our program, many concentrations at GW basically had to do a thesis over the course of a year. For the health policy concentration in particular, we just wrote a memo. I remember when I was working on my memo, I found myself wishing that I could kind of tap into my research skills more, especially since health policy memos tend to be pretty concise, so I can't really go as in-depth as I want to, while my peers in other concentrations who had to write like full-blown theses, they were kind of upset about it because they didn't want to do research. They didn't feel like they signed up for it. So I think really knowing what you're getting into is important. The next thing you want to consider when looking at programs is curriculum and course offerings, and I specify those things separately for a reason. On one hand, you have curriculum. You want to make sure that the program covers everything you need to know to work in public health or to get to whatever next step in your career that you're taking. And you also want to know if the program covers stuff that you're interested in. And that includes both stuff in the classroom as well as external training like professional development, interprofessional training, things of that sort. And I also mentioned course offerings because you want to know if the classes you need are actually available. For example, at GW, there was a certain sequence of classes we had to take in the health policy program. So we needed to know what semester those courses were offered, how many seats were in that class, and whether we'd be able to get those classes in time in order to complete the sequence and complete our degree. Additionally, there was one program that I applied to that had a class that I thought seemed interesting, and I was really interested in taking it. But then when I dug a little deeper, I found out that that class had not been offered in 6 years. So I couldn't go to that program to take that class because that class basically didn't exist at that point. So both making sure that the program offers what you're interested in and also has what they're offering is important. The next thing you want to consider is accreditation. I've talked quite a bit on this channel about the Council for Education on Public Health and how they accredit schools and programs of public health. The general wisdom is that SEAF accredited programs are best, but I do want to note that not every public health adjacent program is SEAF accredited. For example, neither the bachelor's nor the master's in global health at Duke are SEAF accredited, nor is the Master of Science in Population Health Sciences. That doesn't say anything about the quality of the program, it just says that those programs were not submitted for accreditation based on the competencies in public health that SEAF has outlaid. Of course, you shouldn't go to just any program if the university is not accredited by like a local accrediting body outside of SEAF, like it's just straight up not an accredited university. Maybe don't go there, but definitely take into consideration whether accreditation is important from SEAF specifically for the program that you're looking at. Additionally, if a program is new, like for example, I know UChicago is a newer program. If a program is new, they may not have accreditation yet. They don't get accreditation until their first class graduates. So if there's a program you're interested in, definitely look into whether it's worth attending that program with or without accreditation, but just know that that accreditation reflects something about SEAF competencies and then also student outcomes on those competencies. With that being said, if a program is on probationary SEAF accreditation, definitely proceed with caution because that means they failed to meet some sort of requirement. The next consideration is work experience and how the school weighs it in their considerations. Some schools outright require applicants to have prior work experience. For master's programs, that might be a 2-year requirement. For DRPH programs, that might be more years of experience. And even if a program doesn't require work experience to be admitted, they may have preferential treatment for students with prior experience, or they may give scholarship funding to people who are coming in with prior experience. Having prior experience also helps refine your interest when you're applying to programs, so that will ultimately make it easier for you to decide what program would fit you the best. The next consideration is, do you want a concentration in your degree? And does the program you're looking at have that concentration? So, especially when you're looking at Masters of Public Health, some schools do not have MPH concentrations. They may just have a generalist MPH. At the doctoral level, there may just be a PhD in public health versus a PhD in health policy or epidemiology, etc. If you're wanting to go into a specific field of public health, whether that's policy or epidemiology or biostatistics, you're going to want to go to a program that really hones in on those skills. A generalist MPH or a generalist degree in general is going to cover the basic competencies, so they're going to hit you with like basic biostats, basic epi, etc. But you're not going to really get to go in depth in a way that will allow you to perform effectively in that field that you're wanting to go into. So in that case, a concentration might be better for you. The next consideration is funding. Particularly if you're going for a master's, those degrees are not guaranteed to be covered in the same way a doctoral degree would be covered, particularly for Masters of Public Health. To my understanding, Master of Science degrees may or may not be funded depending on if you have some kind of research position at your university. But either way, you have to think about how are you going to fund your attendance at this program. If you watched my earlier video on my grad school application process, you'll also know that Master of Public Health programs are eligible for a greater amount of federal loans, and that may not necessarily apply to a Master of Science program. That distinction is because MPH programs are grouped in with health science programs, so that also applies to like MDs, etc. Essentially, those programs are allowed to take out more loans because they're sort of fostering the growth of the health workforce. The final consideration, which is kind of a two-pronged consideration, is location and cost of living. I only applied to programs in places where I was willing to live, which for me is primarily on the East Coast. And to me, it made sense to be in DC because that's where policy is happening. At the same time, I knew DC had a higher cost of living compared to North Carolina, where I am from, and so I had to take that into consideration when I was ultimately deciding to attend GW. You have to consider how much is rent, How much is it going to cost to buy food? How much will it cost to relocate if you're applying to a program that's not near where you live now? Definitely check if the program has a breakdown of expenses on their website. A lot of graduate programs will have this on their website, how much it costs to live in the area. And I know GW in particular had a spreadsheet where you could actually plug in numbers to help you calculate how much it would cost. That is all I have for this video. If you think I left anything out, feel free to let me know in the comments. And if you like this video, be sure to like, comment, and subscribe. And thank you all for watching. I'll see you all next time.